You're gripping the bathroom faucet this morning, and your right hand feels strange for about 30 seconds. Not painful, just somewhere between numb and not quite yours. You dry your hands, and it's gone. You file it under tired or slept wrong, and you move on. Here is the thing about that moment. Your brain may have just sent you its clearest possible warning, and the window to act on it is shorter than almost anyone realizes. If you want medical information that is honest, specific, and actually useful in the moments that matter, that is what we do here on Doctor's Plain English. Subscribe so the next important conversation reaches you before you need it, not after. I'm Dr. Hannah Fields, and the pattern I see most often in stroke care is not patients who ignored something dramatic. It is patients who experienced something brief, specific, and strange, decided it had probably resolved on its own, and arrived days later after the full stroke had already happened. Your brain is about 2% of your body weight. It consumes about 20% of the oxygen you breathe, and roughly 25% of all the glucose circulating in your blood at any given moment. It is the most metabolically demanding organ in your body, and unlike your muscles or your liver, it carries almost no reserve. Cut blood flow to any region, and the cells in that region begin dying within 4 to 6 minutes. That is not an estimate. That is the biological clock stroke runs on. Around 85% of all strokes are ischemic, meaning a vessel does not rupture, it gets blocked, according to the American Stroke Association. And in a significant proportion of those cases, the brain issued a warning before the blockage became permanent. The tragedy is not that people missed something invisible. It is that they experienced something real, felt it resolve, and trusted the resolution. Picture your brain as a building where every floor runs a different operation. One floor handles your right hand. One manages speech. One processes vision from your left eye. Each floor runs on its own dedicated power line, fed by its own blood vessel. A transient ischemic attack, TIA, which simply means a temporary drop in blood flow, is like the power to one floor cutting out for 30 seconds, a minute, maybe 5 minutes, and then coming back. The floor lights up again. Everything seems fine, but the line that failed did not repair itself. The partial blockage that caused the cut is still there, and the next interruption may last long enough that the floor does not come back online at all. A study by Johnston and colleagues published in JAMA in 2000 found that 10.5% of patients diagnosed with a TIA went on to have a full stroke within 90 days, with roughly half of those strokes occurring within the first 48 hours. That is the window the brain gives you. It is brief, it is specific, and it closes faster than most people expect. I think of a composite patient I will call Margit, whose story reflects a pattern I see a lot. She was rinsing dishes when her vision in one eye went dark for about a minute. Not blurry, not dim, dark, like a shade had been pulled cleanly down. It came back on its own. She assumed she had stood up too fast, finished the dishes, and went to work. 2 days later, she had a stroke. What stayed with me about Margit's story was not that she panicked and ignored it. It was that she was completely calm and reasonable about it, the way most of us would be. And that reasonableness cost her the window. The first warning sign, and the one most likely to be dismissed as something minor, is sudden brief blindness or dimming in one eye. Doctors call it Amaurosis fugax, which translates simply as fleeting blindness. Here is the mechanism. A small clot or fragment of plaque breaks away from the wall of the carotid artery, the main vessel running up the side of your neck toward your brain. It travels into the much smaller artery that feeds the retina at the back of your eye, blocks it briefly, and vision in that eye goes dark. Then the fragment shifts, flow returns, and vision comes back. What matters is this. The artery feeding your eye is a direct branch of the same carotid artery feeding your brain. The fragment that traveled 2 millimeters in one direction could have gone the other way entirely. If this has happened to you even once, even briefly, even months ago, it warrants urgent evaluation. Not a scheduled appointment in 3 weeks. Urgent. The second warning is sudden one-sided loss of function, a hand that will not grip, an arm that will not lift, a face drooping on one side, sensation vanishing from one cheek or one leg. The brain is precisely mapped. Each hemisphere manages the opposite side of the body. When one small region loses blood flow, one specific job fails. Not both hands, not a general heaviness, but one clear, specific loss. Brief, one-sided, and then gone. That pattern is the signal, and it deserves to be taken as seriously after it resolves as it would in the middle of the episode. The third warning covers coordination and speech, and I want to separate these carefully because they feel very different but share the same urgency. The cerebellum, a compact structure sitting at the base of your skull, constantly calculates where your body is in space and how each muscle should fire to keep you moving smoothly. When its blood supply drops even briefly, you may veer sideways on a flat surface, misstep on a familiar stair, or feel a sudden intense spinning sensation with no trigger. Separately, speech can fail in two distinct ways during a TIA. Either the words will not come out despite knowing exactly what you want to say, or words come out fluently but in the wrong order, as nonsense. Both are neurological emergencies wearing ordinary clothing. Now the fourth point, and this is the one I most want you to carry out of this video. None of those three warnings appear from nowhere. The vessel damage behind them built quietly for years. The inner lining of every artery in your body, the endothelium, is a microscopically thin surface whose job is to keep blood moving smoothly and prevent anything from sticking. When blood sugar runs even slightly above normal for an extended period, as it does in prediabetes, that lining sustains slow, cumulative damage long before anyone attaches a formal diagnosis to it. Smoking accelerates that damage directly with every cigarette, while simultaneously making blood thicker and more prone to clotting, a combination that, based on well-established clinical data, is associated with roughly 2 to 4 times the ischemic stroke risk compared to non-smokers with otherwise similar profiles. And here is the detail that surprises most people. Blood pressure drops naturally by about 15 to 20% during sleep. That is a normal, healthy physiological shift. But if a carotid artery is already narrowed significantly by plaque, that same normal nighttime dip can reduce flow through the narrowed segment to nearly zero, especially if a small clot has formed on the plaque surface during the hours of stillness. That is one specific mechanistic reason why some people go to bed feeling entirely fine and wake up mid-stroke, or are found that way. Has there been a moment in the past year, a strange few seconds with your vision, your hand, your balance, your words, that felt odd enough to notice, but resolved fast enough that you talked yourself out of mentioning it to anyone? Here is the 3-word test I want you to remember. Brief, specific, gone. Brief means it came on suddenly and lasted seconds to minutes. Specific means one clear ability dropped out, not a vague all-over feeling, but one job your brain does that suddenly stopped. Gone means it resolved on its own. Most people hear gone and feel relieved. I want you to hear gone and feel the clock start, because brief, specific, and gone is not reassurance. It is a window, and the window has a closing time. 3 tests are worth asking your doctor about by name if you have experienced any of these warning signs, even once, even briefly. The first is carotid duplex ultrasound, an imaging study that shows both the physical structure of your neck arteries and how blood is actually moving through them, including whether a narrowing is severe enough to be reducing flow in a clinically meaningful way. The second is HbA1c, glycated hemoglobin, which reflects your average blood sugar across the past 3 months, rather than a single morning snapshot. It is the test most likely to catch the pre-diabetes range, where vessel damage is already accumulating, but no label has been applied yet. The third is Holter monitoring, wearing a small heart rhythm recorder for 24 hours during your normal routine. Its job is to catch atrial fibrillation, an irregular heart rhythm where blood pools in the upper chambers of the heart and forms clots that can travel directly to the brain. When atrial fibrillation is identified and treated with appropriate anticoagulation under medical supervision, stroke risk in that specific condition can be reduced by roughly 60 to 70%, based on well-established clinical trial data, though your own cardiologist will determine what is appropriate for your situation. 2 more things worth doing today, not eventually. Tell one person who is regularly near you what brief, specific gone means, and agree together that if it happens, you call emergency services immediately, not drive yourself, not observe for another hour, not search your symptoms online. And write down every medication you take, keep that list accessible, and make sure the person you just told knows where it is. Emergency teams need that information in the first minutes, not after a search through 3 drawers. One absolute rule: never start, stop, or adjust blood thinners on your own, based on anything you read or hear. Ischemic stroke and hemorrhagic stroke, blocked vessel versus ruptured vessel, are clinically indistinguishable without brain imaging. Blood thinners that help in one scenario can be catastrophic in the other. That distinction belongs to a medical team with a scanner, not to any of us making a judgment at home. A symptom that vanishes, one eye going dark, one arm going weak, speech fragmenting, balance failing without reason, is not a symptom that resolved. It is a warning with a 72-hour window attached. The vessel damage behind it built for years through elevated blood sugar, smoking, blood pressure stress, and the quiet nightly pressure drop that tips a narrowed artery into full blockage. 3 tests, carotid duplex ultrasound, HbA1c, and Holter monitoring, exist specifically to find the treatable cause before the window closes. Margaret had a window. She did not know what it was. You do now. Thank you for giving this your full attention, because that attention may be exactly what protects someone you love. Share this with the person who would be closest to you on an ordinary Tuesday morning, the one who would notice if something seemed off and needs to know what to do about it. If you want more conversations like this one, subscribe to Doctor's Plain English. And before you go, one question worth sitting with. Is there a moment from the past year that fits brief, specific, and gone, that you have not yet mentioned to your doctor? Everything I've shared today is for general informational purposes, based on real research and clinical patterns I see often. It isn't a diagnosis, and it isn't a substitute for your own doctor, who knows your specific history. Please check with your physician before making any changes to your medications, diet, or health routine.